from drug overdoses. I've been a first responder on 7 fatalities in crisis spaces and watched people die on polypharm substance use. And knowing what's going on with the opioid crisis and the fentanyl crisis, the subsequent fentanyl crisis, I think it's really important for us, as identified as psychedelic citizens in this training, for us to know a little bit more about kind of the landscape of harm reduction, where it comes from, and how to combat psychedelic exceptionalism when it comes to maybe our own internal biases around what substances we might identify as safe or unsafe or clean and dirty, and like what the language choice of dirty is when it comes to identifying what people are using to alter their consciousness. So the harm reduction movement is like a set of practical strategies, policies, and ideas aimed at reducing the negative consequences of high-risk behavior and drug use. It's also a movement for social justice built on a belief for the respect for and the rights of people who use drugs. And that is all drugs and all substances. And so not just psychedelics, but people who are utilizing opiates or smoking meth or...
I'd like to say how harm reduction started.
Oh.
It started in Vancouver, Canada. And at first it was very controversial that there were so many opioids in Vancouver, Canada, because they had the Chinese population coming in with all sorts of drugs.
Yes.
It was controversial that you would provide a place for people who were addicted to have clean syringes and do it in a safe place without getting hepatitis and other contagious diseases.
Yeah.
So first, it was greatly controversial because people said you were increasing drug problems. And it's gradually been adopted, as you can see, very, very successfully.
The first safe injection site was actually in Liverpool, England, started by people who self-identified as junkies, although that is a term that is something that community self-identifies with, but also is a stigmatizing term that other people can't call people junkies, but people can call themselves junkies. And so it really started. There's a fabulous book called Undoing Drugs that goes through the entire history of the harm reduction movement, written by Maya, with a really Polish last name that has C's and J's in it that I can't pronounce. The audiobook version of it is fabulous, and so if you spend time in your car, like, strong recommendation for Undoing Drugs. I was finding reasons to be in my car to finish listening to it, which is rare for me. I was like, oh, I'll just drive and keep listening to this, and like drive around the block one more time to like finish the chapter. But really does this deep dive into harm reduction and drug policy. And so what we can see is, in the late 80s, early 90s, really born out of the AIDS crisis, and needle sharing and what was happening to BIPOC, queer people who were dying of AIDS without treatment and being ignored by public health officials because they were identified as undesirable members of society. And it was really started by nurses and social workers working with people who were dying of AIDS. And people coming in saying, the only thing that's giving me relief right now is the heroin that I'm shooting up. And so you're telling me that I should stop doing that to receive treatment. And harm reduction was, we don't put conditions on treatment. We will feed, you don't have to stop using drugs. We will feed you, we will house you, we will give you clean needles. And I know people who were in New York in the early 90s with, it's now On Point, which is the safe injection site in New York, but with ACT UP, and going out and getting arrested for giving clean needles and passing out condoms, and this kind of like renegade movement of how do we care for people who are dying and not putting conditions on their care? And so from that, from ACT UP, from the 90s, from the AIDS crisis, it kind of shifted into the like 90s club scene in New York, club kids, all the prevalence of MDMA kind of coming out in the late 80s, early 90s. And organizations like Dance Safe were started, and they were out in the clubs being people who identified as drug users, being people who wanted to help people test drugs, keep their drug supply safe. And it really kind of exploded from the public health crisis of what was happening with AIDS into this like club and party scene. And from there, we unfortunately in this country had an opioid crisis of predatory prescribing and overprescribing, and basically devastated communities with opiate addiction. And once the pill mills got shut down, people who were going through extreme painful withdrawal were kind of pushed into drug sourcing in the underground, drug sourcing, or switching from pharmaceutical opiates to injectable opiates like heroin. And now we are seeing a massive uptick of fentanyl in our drug supply, counterfeit pills, a lot of fentanyl contamination in heroin and underground pharmaceuticals. Bunk Police, which is a lovely drug testing organization, and they sell drug testing kits, went down to Mexico. They did like an investigative journalism thing, and they went down to Mexico and went to a whole bunch of Mexican pharmacies in resort towns and tourism areas and got Adderall and opiate and OxyContin and a couple of other pharmaceuticals, and came back to the States and mass spec tested all of them, and like more than 50% of the counterfeit pills had fentanyl in them. And so even if people think that they go to a pharmacy to buy drugs, they're still getting xylazine and fentanyl contamination in what is being sold as pharmaceuticals. And so it's very dangerous when you guys started using drugs in the 60s, but like when I was in high school, when I was in the 90s, drug experimentation was not all of a sudden accidentally fatal the way it is for kids these days. I didn't think that, if I took a Norco from one of my friends, then I might die. And like that is a very big reality of what's happening to our youth and to to people who use drugs, especially people who have genuine pain and can't get their pain treated anymore because they have doctors that don't want to write a prescription because they're concerned about overprescribing. And so we're in this crisis where there's a subsection of people who are looking for treatment or are engaging in substance use, and it's now potentially fatal every time. And so it's really scary. That is allowing us for this lovely shift in care, which is also that like substance use, especially substance use that is disordered, is not a moral failing. Like people who use drugs are not, like there's no morality attached to it. Recognizing that trauma and adverse childhood events and other factors really play a role in how people are self-medicating and how people are treating their trauma and their ailments, whether it's depression. There's a lot of climate change anxiety happening right now, and how do we treat that? And when the tools in our toolbox are weaned down, we do the thing that we know is going to hit the dopamine, instead of we could try to meditate, we could try to eat healthy, we could try to do all these things, and it's not working. And so we default to the thing that we know is going to work, which is utilizing substances to help us change our brain chemistry. So the National Harm Reduction Coalition has put out 8 guiding principles that I would like to share with all of you, that kind of helps us frame how we view drug use and substance use and our own internal bias. So the first one is that we accept, for better or worse, that licit and illicit drug use is a part of our world, and we choose to work to minimize its harmful effects rather than ignore or condone it, because ignoring problems doesn't really work. 2, we understand that drug use is a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence, and acknowledge that there are some ways in using drugs that are clearly safer than others, right? Using a clean needle to inject drugs is clearly safer than using a needle that has been used before. And so there are safety measures that can make substance use safer versus riskier. 3, establishes quality of individual and community life and well-being, and not the cessation of using drugs, as the criteria for successful interventions and policies. One of the things that we found out of the Liverpool safe injection site, which was giving people access to tested clean heroin and clean needles, is people would come into that program, they would utilize safe injection methods, and once they were not spending all of their time drug seeking, trying to find a dealer, trying to do all these things, in about 2 years from enrolling in the program, most of those people have self-selected to wean themselves down to no longer be addicted to opiates. But in the beginning phases, in that first year, it shouldn't be and methadone clinics are the only clinics that do this, which is, if you're not here by 9 a.m., we don't treat you. If you're not here, like, there's all these stipulations, especially around opiate users, that if you can't follow our rules, then we're going to punish you, which is ridiculous. Can you imagine if somebody was like going through kidney dialysis and they were like, oop, you're 5 minutes late for your appointment, so now you don't get dialysis? Like, that's absurd. And it's like a medical intervention. And so making sure that, like, the criteria we use in what we talk about is successful substance use is not based on whether or not somebody's stopping. 4, calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs in the communities in which they live in order to assist them in reducing harm. We're not here to coerce anybody, we're not here to pass judgment on anybody, we're here to help people save lives. And, like, bottom line. And we're not expecting them to travel across town. That's why harm reduction outreach, especially in homeless populations, is so wonderful. Is we'll go out into Skid Row or into homeless encampments and make sure that they have Narcan, make sure that they have condoms and tampons and healthy snacks and clean water. And I think COVID did a really good job in us looking at the ways that we treat our unhoused community members, to be able to give them the resources that they need to survive and make self-determined decisions. So 5, we ensure that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. So right, that is why SAMHSA invited us out this week, is because they're like, you are people who work in communities with people who use drugs, and we don't want to, as people who work for the federal government, they have a drug-free workplace. They are not allowed to use drugs. So they shouldn't be writing the policies and developing the programs without having the real voices of people who are using substances to, like, help design them. 6, we affirm that people who use drugs themselves as their primary agents of reducing the harms of their drug use, and seeks to empower them to share information and support each other in strategies which meet their actual conditions of use. This we saw in Undoing Drugs, recommendation again for that book, but we see this from a public health perspective in bleaching needles, which was the first way. If we couldn't get people clean, like fresh syringes for IV drug use, There is a way to bleach out needles, which is to run bleach through your needles, which would reduce the likelihood of hepatitis C transmission. And what would happen is we would teach one person how to do that, and then they would go back into their shooting galleries and teach all the other IV drug users how to use it, and we were watching from a data perspective of who they were teaching to do this and watching the health risks reduce in those communities. And so it's not about you have to come to us, but it's how can we teach you, how can we give you the tools that you need to be able to have people feel empowered that they can keep themselves safe. 7, we all recognize the realities of poverty, class, racism, social isolation, trauma, sex-based discrimination, and other social inequalities affects both people's vulnerability to and capacity for effectively dealing with drug-related harms, right? People who are economically stable can afford to go to drug treatment. They can afford childcare. They can afford healthcare. And unfortunately, in this country, like healthcare, 100 million Americans, 1/3 of our population, doesn't have a primary care health provider because so many people are afraid of medical bankruptcy that they are afraid to seek treatment. And so, recognizing that this is an American problem. Same with fentanyl; it doesn't really exist in Europe. And so this is like our neighborhood, our problem, like a U.S.-based problem. And how do we help people? And then 8 is we do not attempt to immunize or ignore the real and tragic harm and danger that can be associated with illicit drug use. And so looking at this, here are some harm reduction community branches, because when we look at harm reduction as like a giant pie, right? Psychedelic harm reduction or psychedelic risk reduction is like a very small pie slice. There aren't a lot of psychedelic users out there compared to people who are drinking alcohol, which has the most societal harm and the most physical harm, especially compared to psilocybin use. And so there's like all of these community branches. There's high-risk drug use and opiate use. There's vulnerable populations, which would be homeless outreach, people who work in the sex industry, the LGBTQIA+ communities, people who are food insecure, people who have economic insecurities. And then there are kind of these 2 psychedelic branches, one being recreational psychedelic and one being intentional psychedelic. And we kind of merge between these 2 communities of I like to exist in both of those spaces. Recreational psychedelic is really festival and event-based services. People who aren't looking for medical intervention, people who are engaging in substance use because it feels good, they want to have fun. Ecstatic joy is part of the human experience, and we should not restrict ourselves from like allowing ourselves to have like ecstatic joy bliss experiences. It's so silly that I mean, it's also patriarchy and like Christian colonialism and everything else, which is like the restriction of people, you know, of drumming, right? Drumming is a huge, powerful altered state experience. Drum circles that connect us with the rhythms in our body. Like, no wonder that was banned by Christian colonialism, because it empowers individual people. There's, you know, I like going back to Footloose, right? Like the evangelical movement of we're not even allowed to dance. We're not, right? Because being in our bodies, having somatic connection with ourselves, makes us feel empowered, gives us a connection to the world around us, connection to our community. And so those things get restricted by colonialism and patriarchy. And so one of the
they don't want us to know that we're all God.
Right. They don't want us to know that we are divine, and that we don't need an intermediary to have spiritual experiences. Like, we are our own inner healers. And that's also, and we'll get into it later, but around psychedelic facilitators, and what happens with ego inflation, and then what happens with the gatekeeping of the ego inflation around the like, oh, I'm your healer, and it's like, no. I am a facilitator that creates a space for you to do your own healing. Like, I'm not doing any, like, I don't have any special powers. I'm not, I don't claim to have any special powers. Anybody who claims to have special powers, like, I might think that I am God and I am divine and that and I have the ability to heal myself, but the fact that if I think that I can heal other people, like, it might be delusional. I can create spaces for people to connect to themselves and heal themselves, but like, and that's what we do when we create safe spaces, when we provide services, when we become sitters, or when we do this work to be able to help other people. And it's because we have experienced great healing within ourselves, not I want to heal you. And so it's a really important distinction between what we're seeing in psychedelic cults, especially psychedelic sex cults. It's a scary avenue that we're going to see a lot of in the next 5 years. And then really, how do we create, and there's going to be a language shift soon from psychedelic harm reduction to psychedelic risk reduction, because many psychedelic users don't feel that psychedelics are harming them, so why would they need to have harm reduction around it? But there are inherent risks to anything, just like driving a car. And therefore, we're going to reduce the risk around things going wrong versus harm reduction. And so in this realm of this little pie slice of psychedelic harm reduction, here are education and information. There are amazing resources out there, Arrowhead, Dance Safe, Drug Policy Alliance's Just Say No program. There's a safer partying program that's now being launched in conjunction with the William Nash Foundation to provide science-based drug education on college campuses, and they're launching it at Stanford. Nest puts out a 6-week course called Know Your Stuff that deep dives into all substances and is a working group that's currently running right now. Training and skill building, learning about how to hold space and keeping everyone safe. We're going to go over Nest care model and how I do the work. Zendo Project, which is now relaunching and redoing their training. And local organizations like the Aspen Psychedelic Resource Center. And I really think that the best practice is in small groups of friends being able to be right, and you can take turns of who's gonna be the the safety monitor, right? Who's gonna be I'll sit this one out, because you always need, Bob Jesse just said this to me, which is if you're doing if you're engaging in altered states practices, there always has to be one person who, if the cops knock on the door, somebody can answer the door, right? And so somebody has to stay at ground level, right? Maybe that's also a microdose. Maybe that's, if you're a daily cannabis smoker or something like that, that doesn't mean, you have to be absolutely sober and not take your ADHD meds, or not, smoke a little bit of cannabis and white knuckle it through. Then you're also not at your baseline, you're below your baseline. So figuring out what your baseline is to be able to, and God forbid somebody slips and falls or twists their ankle or by mistake cuts themselves or steps on a piece of glass in an ayahuasca ceremony and now there's blood everywhere, and how do you, combat those things? And so skill building and training, I really think, is get the knowledge and then practice with your friends. But now that festivals and events are back, also you can go out and volunteer. You can volunteer for Zendo at Burning Man. Providing direct services, and so work and volunteer in your local communities, not just in the psychedelic space. I think a vital part of psychedelic integration of how are we going to take these grand lessons that we learn when we go on these cosmic explorations, How do we stay grounded in reality? I genuinely think homeless outreach, going and working in soup kitchens, going and working, even as just volunteer, like go to like mission and for Thanksgiving and decide you're gonna be the person that's gonna like scoop out mashed potatoes, but making eye contact with vulnerable populations, having conversations with people who are not of your community, who don't identify in the same way that you identify, is the thing that keeps us grounded and makes us not be isolated in these like silos of the psychedelic renaissance.